Patty, do you want chicken? Where'd she go?
No thanks.
For the foreseeable future, one last dinner together at their home for this family in rural Oregon, accompanied by a prayer for an unexpected challenge that has uprooted their lives.
Thank you for all the blessings that you've given us, and thank you for the challenges that you've brought us, and thank you for helping us overcome them.
When Alicia and Shane Alderson decided to expand their family, they didn't expect the maternity ward at their local hospital in Baker City, Oregon, to suddenly shutter, leaving them 40 miles from the nearest hospital with a labor and delivery unit.
Got my hospital bag, yeah.
At age 45, Alicia Alderson decided that she couldn't risk being far from a maternity ward in case of an emergency. So with just a few weeks left in her pregnancy, she and her family packed up and moved into her brother's home near Boise, Idaho, to wait for the new baby to arrive.
We don't feel safe being so far away from a birthing center.
The Aldersons' temporary move to Boise could last several weeks. It took their daughter out of kindergarten, and it's taking the family away from elderly grandparents. Alicia Alderson also won't have the doctors she knows.
I've just taken it for granted, really, that I'd always have my doctor and I'd be close to safe care. And that's all just kind of gone out the window, and then just trying to decide what are we going to do, because as you know, things can happen all throughout pregnancy. And if you don't have somewhere where you can check and make sure things are okay, it's just really scary.
The stress experienced by the Aldersons is a growing occurrence in rural America. The American Hospital Association says at least 89 obstetric units closed in rural hospitals between 2015 and 2019, and more have shut down since. As a result, fewer than half of rural hospitals have maternity units.
To just shut this kind of service down, it isn't safe.
Hospital officials cite a decreasing number of births, staffing issues, and low reimbursement rates for people on Medicaid, the federal health insurance program for low-income people. They say these factors have combined to make maternity units unsustainable. But across the country in Tennessee, there is an example of a possible solution for maternity care deserts. Freestanding, midwife-led birth centers are gaining ground as one answer to maternity needs in rural areas.
A more wise and effective way to kind of triage people is midwives do all the normal and obstetricians do the high risk. And that's how it is in a lot of European countries. And then you're getting the appropriate level of care for what their risk is. They're high quality, low cost. So in terms of cost, that's a huge savings.
At the Farm Midwifery Center in Tennessee, expectant mothers get help, advice, support from other moms, and checkups. But in case of some serious problems or emergencies, midwife centers rely on hospitals. Still, Rohini Mock, one of the mothers at the farm, says the knowledge she has gained from the midwife center will help guide her.
And there may be a circumstance that has us transferred to the hospital, but I think preparing myself with knowledge and what I want in that circumstance allows me to feel good about it, like the decisions I'll make, skin to skin right away and delayed cord clamping and things like that I can kind of bring with me if that were to happen.
Now in Idaho, the Aldersons move in their stuff to their temporary dwellings. The experience has led Shane to work almost full-time to find short and long-term solutions for his county.
When this crisis has gone from eastern states to the western states, I think we're going to have a national conversation about reimbursement and the roles and responsibility that critical access hospitals play in rural America. And it's hard, but I think that something good's going to come out of this.
Claire Rush, Associated Press.